2, 1. Hello, everybody. We are now live in Facebook and on Zoom. We have so many lovely people with us on Zoom, and we would love to have you guys too. Zoom is the place to be because we are on our last night together, and we are going to do some 12 lead stuff tonight, which is fun. We've been kind of leading up to it. We've done the paper, we've done the waves, and now we're going to do the 12 lead. We did arrhythmias last night, which was really fun. I don't know about you guys, but I loved the arrhythmia section. Tori's in the house. Also, a little side note, if you need your workbook still, please don't hesitate to reach out, put workbook, and we'll get that to you forthwith. Actually, let me stop share there and get the right slideshow up. So we have a special treat for you guys tonight. A special treat. We have a drawing to do. We're going to be drawing for the giveaway that we had last night. So we're going to do a drawing for the EKG badges. So we're about to do that. I have my names in a bowl. I'm so excited. And we're going to be doing the Carl Barker EMS scholarship giveaways tonight too. So we have lots of prizes, you guys. Tonight is the night to be here, let me tell you. So it should be now 5:30 PST on the dot. So let me share these slides with you. And I think it should work. Yeah. Okay. Awesome. Okay. So welcome in, you guys, officially. Good evening, Nuria. Good evening, Muna. I was just telling Karen before we hopped on, it's nice to see all you guys' faces. I know Michelle is definitely excited about that too. She loves interacting with you guys. Bria's in the house. Kara's here. Kara, I see you sent me a message. I'll have to obviously get back to you when I'm done. Okay, so let's kick it off with talking about the Carl Barker EMS scholarship. So, as I mentioned, if you have been here with us, Carl Barker, he's pictured here. He's one of our longtime members, over 2 years now in our group, and he is going to be giving away, we will be giving away 2 scholarships tonight to folks that want to join us in the class we're starting next week, to kind of keep the momentum that we have going, right? And if people want to join us, we're going to give you a specific hashtag to drop, and we'll be picking random names from the hashtags. So we'll be doing that in just a few minutes. We'll be giving you the hashtag when Michelle covers what she's going to cover. And then at the end of the class tonight, we'll be doing the drawing. And so if you are a lucky winner, you'll be getting a month-long scholarship in our program, where we start off with basic EKG, we start off with basic arrhythmia, and we just kind of take this but flush it out. So if you like what we're doing and you want to participate in that, stay tuned. Okay, now today is our basic 12 lead day. We've had an amazing 2 days together. I feel like we've really had a great time. Now, it looks like Ruben just posted the link, Kara, and so did Tori. We definitely want you to hop on, Kara, for sure. So we're going to do 12 leads. But before I do, I want to go ahead and get the drawing out of the way for the badges. Now, remember last night, you guys put a hashtag to win the badge. Now I'm going to open one to show you again what you're winning, because we want to show you, but they will come in this envelope. So when you see an envelope like this, you'll know. Okay, so we're going to pick 4 winners. So in this envelope comes a paper instructions on how to use the tool, but this is what it looks like. Oh, actually it's in plastic. That's not very helpful. Let me see if I can take it out. Yeah, okay. This is what the tool looks like. So once you get through all your plastic, okay, this is what it looks like. So it's an arc-out window, and it has a little knobby thing here where you can stick it on your badge. This is where mine lives. It comes in this little case. So like you can pull it out of the plastic case if you don't want to do that, and it'll still hang on your badge like this. This is how mine hangs. But if you want like a secure housing for it, you can do that. But this is a really cool tool. It helps me in the clinic. I love this. I was introduced to this by an EKG tech I work with, actually. And so I was like, oh, I'm in love with these. So we're going to give away 4 of these tonight. Okay, so let's do the drawing for those, and then we'll get on with our lesson. Okay, so winner number 1 for badge 1 is Noelle. So Noelle, you've been on with us. I didn't see you yet. You may be on, but Noelle, you're definitely the winner number 1 of the badge. Okay, so I'm gonna put your name over here, And then we have 3 more winners. So we have Karen. Hey, Karen. What's up, Karen? So you're also a winner of the badge. And then 2 more, we have, oh, Bria. Bria, you're the 3rd winner. Bria, so congratulations. And winner number 4 is Muna. Muna, I know I saw you on with us, Muna. Muna, so guys, if you're Bria, Karen, Muna, or Noelle, message me in my private Facebook, not in, yeah, Noelle Machado is on Facebook. Don't message me in Zoom, message me in FB land, okay? And I will go ahead and get those to you. So excited for our winners, yay. Let me also just make sure that we get Michelle off of, let's see if we can find Michelle. Michelle, our co-hostess with the mostest, we got to make her a panelist before we get started. So make co-host. Okay, Michelle. So congratulations to our winners. Yay. Okay, so I'm going to go over a few slides real quick. And yes, congratulations. I know, this is so exciting. So how do you feel like this about EKGs? Okay, a lot of you have come to me and you've said, Jen, this is a great class, but this isn't enough for me to get confident with EKGs. And I'm like, I know, right? It actually takes a lot more than a 3-day mini class. But it does, however, start to give you the confidence and some traction in going back with the basics and really understanding them. So practice is actually what the answer is. How do you feel like this? Practice, okay? So you have to also understand that the electricity of the EKG tells us about the status of the arteries. So that's the other part of this picture, okay? And then what I want to do now is I wanted you to go ahead and grab a pen, okay? Go ahead and grab a pen. And also if you need the workbook, okay, we did that on day 2. There's actually 3 pages for tonight. So go ahead and type workbook in the chat, wherever you are, if you're on Facebook or Zoom, and Tori will make sure to get this sent out to you forthwith. Okay, we want you to print this out before we get going in the hands-on time so that you can write on the stuff with us, okay? All right, now, here's where we start getting started with what a normal EKG is. Now, this is Remy again, the German Shepherd. He's the EKG reading German Shepherd. And it looks like he's giving us a list of things that we should look for when we're doing our little checklist to see if an EKG is normal, okay? So first of all, we have to make sure that our family is intact. That's step number 1. What do I mean by that? Well, remember on night 1, we said the P wave is the mom, the Q-RS is the dad, and the T wave is the baby, right? So they should all be holding hands, and the T wave shouldn't be too far. The P wave shouldn't be too close. Nura says, she loves Remy. I know, me too. I wish he would come on camera, but he's too tired tonight. So we also want to make sure that all of the waves are following the rules. So let's recap. Remember we said the T waves should be upright in all the leads except for 2. Do you guys remember what they are? You guys remember the 2 leads where the T waves should be inverted or down. Let's see, we have some chats. Okay, so Tori is saying we will get the workbook to your messenger. She's giving you guys the link. Thank you, Tori. What are the 2 leads? Can anybody type it in? Oh, Heidi got one. And Nuria, good. AVR and V1, okay? T wave should be inverted, AVR and V1. Otherwise, everybody should be upright. Good, okay? Now, the other part of this is that we need to have normal voltage. So voltage represents the height of the QRS, okay? We don't want it too small. We don't want it too big. We want it just right, like Goldilocks likes for porridge. And then the other thing is we're looking at the axis. We want to have normal axis. We want to have no extra beats, of course. We showed you an example last night of some extra beats. We actually showed you a trigeminal EKG pattern, right? Ectopy. And then we also wanted to make sure you have a good quality tracing. So that means that there's no artifact. And so I know that a lot of people are shy about asking for another EKG if they don't like the one they have. But here's the thing. you need to be able to see if there's AFib or not. If you can't see that because there's too much artifact, or if you can't see ST elevation, then you have to ask for another EKG. There's just no bones about it, okay? So make sure you insist on a good quality tracing. It's just like when we do an x-ray. If we get a subpar x-ray, we can't see if there's a fracture. So we need good quality. Okay, so let's talk about what actually makes the ECG normal. And I will tell you that no, it's not because it says normal EKG, right? Although I wish this was true, I have seen really bad things, Brugadas being one of them, be labeled normal ECG. So the machine software is not always right. We talked about that on night one, but knowing a couple of things that you should see on a normal EKG. First of all, looking over here at just the distribution, right? We're looking at the family, we're looking at the PQRST, right? They're all standing next to each other. And yeah, Michelle says, good analogy about the x-ray. It's true, same thing, right? We're looking at the size of the waves. We're looking at the direction, right? We're looking at ABR and V1. ABR and V1 should be inverted. All the rest of the T's are up, right? And Tori is remembering that Brugadas, that it's cold in the V's. I love it, Tori. I love it. Tori is not medical, but she knows all the things from watching this challenge. Like, she's just amazing. So pattern recognition is what Tori's doing. Okay, so going over here, the other thing is we have to make sure all these numbers are normal. Oh no, Wendy says her son has Brugada. Oh, ay Dios mío. So going over this, these numbers right here, they need to fall into the normal parameters. These numbers here are called the intervals, okay? The intervals. So unfortunately, on the ECG, the machine does not print out normal reference ranges for us like it does with a lab value. So for example, 60 to 100, right? That would be the normal intervals for ventricular rate. So 84, that falls between 60 and 100. The normal interval for PR, right, is 120 to 200. We talked about that already. So 150 is normal. 76 is the duration of the QRS, the width, and you can see with your eyes, it's not too wide, right? Over 120 is the magic number, and it's still under 76. So check, we're good. Now the next number is the QTC, that's the 446, and it should be below 460, which it is. And then the last number here represents, the middle number 51, represents the axis, okay? So 0 to 90 is the axis, and this is falling normal. And then the last thing that you want to just really quickly look for again is good quality tracing. And then of course, looking at that baseline to see if there's any ST elevation or depression. Now this line that we make, we have to make it on every single line on the EKG. We have to go across, okay? And we do that because if we don't, sometimes our eye will miss the ST elevation if it's really subtle. So actually, this tool, this is literally what I use in clinic. And this is funny because you guys will laugh. This hangs on my badge. Actually, I didn't realize it had a little punched out thing if you wanted to wear it this way. But this sits on my badge and I use this. I take it out. I take the straight line on my EKG in front of the patient and I just quickly scan through. I make that straight line with my archive window over the EKG using the TP segment as the most isoelectric line. And when I do that, they think that I'm scrutinizing their EKG, which you would think people would be like, oh my gosh, that's such a newbie. You don't obviously know what you're doing if you need to use a tool. No, people love it. It's kind of like, and this is a surprising thing too, you may have noticed this, when you listen to someone's lung sounds for a really long time, like all the points or their heart for a really long time, they're like, oh, they like love it because they feel so paid attention to. It's the same thing here, right? So really this tool is a great thing. So you guys who have won, congratulations, like you're gonna love this tool. Okay, so if you don't have the tool, you can always just take a straight edge and make a line, right? Just like I did here. So that's the normal ECG, that's the normal reference ranges, okay? And also knowing that, one more thing before I talk about scholarship, is that the R waves in lead 1, 2, and 3 will all be pointing up as well, okay? That's also a sign of normal axis. We shouldn't have all the R waves pointing down. If they would be all pointing down in 1, 2, and 3, we would have to think of something like VTAC. So normal is those little blue circles, up, up, and up, and lead 1, 2, and 3. Okay. All right. Now, while I'm going to turn over the floor to Michelle, I'm going to be giving you guys the hashtag that you're going to need to put in either Facebook or Zoom. And I'm going to, at the end of class, Michelle's going to talk about 2 slides real quick. I'm at the end of class going to draw. While she's doing this, I'm going to write down your names for the scholarship, and then I'll draw the winner. So again, I'm going to tell you what you'll win in the scholarship a little bit later, but just know that it's free 30 days of class with me and Michelle, just like this. So Michelle, are you on with me?
Yeah, can you hear me okay? I'm off mute now.
Yep, I can, and I am going to advance the slides and then give it over to you, Michelle.
Okay, so what I like to do, and I teach a lot of the basic stuff with Jennifer, so what I like to do is use an analogy of the 12 lead as a camera analogy. So I'm not going to do the whole
hour and a half.
Yes.
I forgot to give them the hashtag.
Oh, sorry, go ahead.
I'm sorry, I forgot. Okay, you guys, the hashtag if you want to be entered to win for the scholarship is EKG, hashtag EKG Launchpad. Okay, sorry, Michelle, it's all you.
No problem. Okay, EKG Launchpad. Get it, because you want to get in the group. Awesome. Okay, so what I like to do is an analogy of a camera. So when I'm looking at my heart itself, I'm going to say, where is the electricity? Where are those vectors? We like to use some crazy, professional words at times. I like to use, how is the electricity running through the heart? Because I need a visual. So the electricity is going to be going normally from the right-hand side of the heart to the left-hand side of the heart. And when I put an EKG electrode on my patient, wherever that positive electrode is on the patient becomes the camera. So basically, I have 12 leads. I'm going to take 12 snapshots of this heart. I'm going to be taking lead 1, AVL. I'm going to come down here at the bottom of the heart, and we're going to use some fancy word called inferior aspect of the heart. And I'm going to take a picture of my lead 2 and lead 3 and AVF, all with a little electrode that we're going to put on the left lower limb of the heart. So when you, or on your body, when you put an electrode on your patient, that electrode is actually taking a snapshot of the heart. So now I have a picture of the inferior aspect of the heart. I'm going to even take a picture of the front of the heart. So all those little leads that you put across the front of the heart, the precordials, that's actually taking a very close-up picture. So I'm going to take V1, V2, V3, V4, V5, V6, all around the front of the heart. And I'm using my camera to do that. But what you would, as an analogy, what you would be putting on your patient is your positive electrodes. So those little electrodes that you're putting on your patient are where the camera is coming from. So that way, when we look at that EKG, I'm now looking to see, what is that upward deflection? What is that downward deflection? So when Jennifer says AVR and V1, the T waves need to be inverted, that's because the electricity is going a different direction. Can you advance it to the next one, Jen? Please, ma'am. Okay, so I'm just going to do a quick one here right now. Lead 1. So in lead 1, we're not going to give away the whole class because y'all don't want to sit that long anyway. So we're just doing a quick little one here. So in lead 1, my camera's over here on that lateral wall of the heart. So I'm looking at my lateral wall when the camera's over here. That lateral wall, specifically this high lateral wall, my camera guy's right here, and I'm looking across the heart. I'm looking across the heart. So if my heart's sitting like this, I'm looking from my left shoulder to my right shoulder. Everything should be upright because the electricity in the heart, the normal electricity in the heart, is going from the P wave, like Jennifer talked about yesterday, from the sinus node to the AV node to the bundles to the left ventricle. All that electricity, those vectors are moving this direction. So if I put an electrode over there or my camera, my waveform on paper, so now look down there at the bottom and you see that waveform, P waves, upright. P waves upright because the electricity is coming toward the camera. P waves upright. QRS upright. T waves upright in lead 1. Hit the advance button just one time, Jen, please. When we look at that, now that camera is also looking at the lateral wall of the heart, in which coronary artery we say the coronary artery that's right there is the circumflex artery. Now hit it one more time, Jen. The same thing with AVL. I'm the same camera. All I've done is angled my camera down toward the heart. So instead of looking over toward the right shoulder, my camera angles down a little bit toward the heart. But on paper, because the electricity is still going like this toward my camera, when it's going like that, I'm still getting positive P waves, positive QRS, positive T waves. So when we say you shouldn't have a Q wave, Q waves mean electricity going away or something's wrong with that myocardial area. Electricity can't get through there. Does that make sense? So electricity should be going this way. If it goes away from that positive electrode, something's happening. That's all axis is. Electricity going away from the camera. That's it. Hit it one more time, Jen, and that last little picture will come up. We're still looking at AVL, the same area of the heart. The camera is still looking at that circumflex artery. So that's kind of my analogy on how I teach the each lead of the heart. I explain each lead, but lump them together because that camera, when it looks over here, those two leads that are looking at that same area of the heart, those be sisters. They'd be sisters, not twin sisters, just sisters, because they're looking at the same region. I like to use the word area because that's how I think of it in my head, but the same region of the heart. And then Jennifer is going to advance on that and say a little bit more about those regions of the heart. Okay, I think that's it, Jen.
Thank you, Michelle. So as you can see, Michelle, you can see why we have Michelle keep coming back and like being the most amazing cheerleader / coach ever, because she has a way of looking at things that just for visual learners that really, really pops. So thank you, Michelle, so much for sharing that with us. And that gave me a chance to write down everybody's names. So now what we're going to do is we're going to jump into, if you want to go to your workbook page that looks like this, if everybody wants to pull that out, we're going to go ahead and write these steps down and we're going to go through them together. Okay. So if you could get out that page of your workbook, this is where we're going to talk about our 10-step approach, because a lot of you like systems. Now, this is not the only system we teach. Michelle teaches another way to look at the leads. We teach you color coding. We teach you all the things, right? But this is just for general purposes, a way to basically keep the blinders on yourself when you're looking at an EKG. The reason why we made this list, okay, is because we know, and I do it too, everybody does it, right? We see something super cool on an EKG and our eyes go directly there. But this keeps you from doing that, right? It gets like the blinder on the horse. The horse wants to go look at the carrots, right? But keep the blinders on. So step number 1, if you would write this down, big sick versus little sick. Now, what that means is it's the same thing with a patient. So when you see a big sick patient, okay, type in the chat, if anybody knows what I'm talking about, a really big sick patient, give me an example in the chat, and then I'll equate it to the EKG. So in the chat, what do we mean by big sick? What do you guys think? So big sick would be, for example, like for me, I'll tell you my example while you guys are typing in. Oh yeah, Kara, good. Symptomatic and diaphoretic. Beautiful. I love that. So that's kind of what I was thinking of in my head, Kara, is a chest pain patient who is kind of pale, cool, and gray and leaning, against the gurney, who's quiet. Lisa says STEMI. These are great. Okay. So anything that's going to make you stop right now and do something and not do the rest of these things is big sick. So for example, in EKG terms, asystole, VTAC, VFib, right? Those things, or supersinus Brady or PEA, those things we're going to stop right now and address. Now, if it's not one of those things, then we're going to go on and we're going to call it little sick. So Jamie says alert, not alert. Yeah, that's another good way, right? So if they're not alert, that's a big sick patient. So little sick is like we have time to look at the rest of the EKG. So that would be like, okay, we see a Q wave, or okay, we see, I don't know, like a PVC or a PAC. That's not something that we're going to stop and drop. Stop, drop, and roll. Okay. The next thing we're going to do is we're going to, if we pass the criteria to keep going, we're going to look at the rate, right? Is it too slow, too fast, just right? Number 3 is rhythm. So write that down. Number 3 is rhythm. Number 4 is the intervals. That's the numbers we just went over. We're going to scan those. Axis is part of that, step 5. And axis can help you if you have a wide complex tachycardia, for example. Axis can be super helpful, deciding if it's an SVT versus VTAC, right? That would be a good place. Now, number 6 is going ahead and looking at those ST segments. So that line we just showed you, that's us looking at the ST segment. And we're looking to see if there's any elevation or depression of that ST segment. And if there's elevation, then we have to start going into our calculations of how much and does it meet STEMI criteria or not. And then the next thing is we look at number 7, we look at, is there any thickening of the ventricle? Is the voltage real big or voltage real small? If it's real small, we get worried about things like pericardial effusion. And then we're going to do number 8, where we analyze the T waves. Are they all following the rules? Are they pointy? Are they too big? Are they flat? Are they symmetric? Like there's so many things to talk about with the T wave. You have to analyze them very well. And we're looking for Q waves. We're looking to make sure the PQRS are married, and we're making sure that the QRS is not too wide. So let's talk about that. What's the number that makes a QRS too wide? If it's under, or if it's over, what number makes a QRS too wide? Do you guys remember? We talked about this, I think, night 1. 3 boxes. Tara, yes, okay. And another way to say it is 120 milliseconds. Both are the same thing. So 120 or 3 small boxes. That's what our QRS should be below. If it's narrow, okay, we want our QRS narrow. And then the last part of this is we're going to do our chief complaint based approach. So what that means is we're going to go look at the patient specifically for the chief complaint. So like, for example, if you have a shortness of breath patient, can anybody think of an EKG finding that you would want to look for? Oh, Muna put another way to say it. Less than 0.12. Yeah, good job, Muna. There's 3 ways to say that. I like it. So think about a shortness of breath patient. Can you give me an example of something you might look for on the EKG? Specifically look for, because you know, shortness of breath, especially if they're post-COVID or they're on birth control or they smoke or they have unilateral calf edema or they have localized pain in the chest. Are we thinking of anything we would be worried about there, guys? If that was me, what would you worry about? I'd be worried about a pulmonary embolus. PE, yeah. Okay, so we'd be looking at our EKG to see if there's signs of PE. Now let's talk about the sections, okay? The sections of the EKG. So Michelle, do you want to take over real quick on telling them about the sections?
Sure. Yeah, I couldn't get it unmuted. Yes. So what we talk about, you're talking about the contiguous leads? Is that where you were going with that? I'm assuming that's where she's going with that. So when I'm talking about the areas of the heart or the regions of the heart, and I'm not sure if I can draw on her screen or not. Let me see if I can. Maybe I can. Yeah, let me see if I can draw on her screen. So when we talk about the areas of the heart, we talk about the regions. So you heard me say right here that lead 1, when I said I was looking at my lateral wall, and AVL, I'm also looking at my lateral wall of the heart. It stopped me drawing. Let's see what's going on here. Okay, there we go. So those are the regions of the heart. When I'm looking at that area of the heart, I'm literally looking right here at this lateral wall. So if your patient's coming in, they're having a lateral wall MI. The 2 leads that I could quickly glance at to see, is there ST elevation? Is something going on? I'm going to look at lead 1 in AVL. I'm going to stick my camera, and I'm sorry, I keep going back to the camera. It's just how my brain works. The camera is going to be right there. 1 in AVL. I'm looking at that area of the heart. So that's my lateral wall of the heart. Those two leads are contiguous, which means they look at the same area of the heart. So the next area of the heart is lead 2, lead 3, and AVF. So those areas of the heart are the bottom of the heart, or the inferior aspect of the heart. So now my camera's down here, and I'm looking that one little camera, lead 2, AVF, lead 3. It's the angle of the heart, the same electrode. I'd only have one electrode down there. It's going to be that left lower limb on my body. But when that camera's down there, it's going to angle. Lead 2 is going to look at the right shoulder. Lead 3 is going to look up at that left shoulder. And AVF is going to look straight up at the heart. But I'm only looking at that bottom of the heart, that inferior aspect of the heart. And the coronary artery that perfuses that inferior aspect of the heart is the right coronary artery. So right over here, I'm looking in lead 2, 3, and AVF. I'm physically taking a picture of the inferior wall, and your patient's coming in. Oh my gosh, my patient's coming in. They're having a right coronary artery. What do we do? What do we do? Look at lead 2, 3, and AVF. Look at lead 2, 3, and AVF. Is there any ST elevation there? That's where you would see it. Then you're going to say, oh my gosh, what else are we going to see when we look at 2, 3, and AVF? We're going to worry about the right ventricle. If the ST elevation is greater in lead 3 than 2, I may be having something with the right ventricle going on. Now I got to worry about a right ventricular infarct on top of everything else. And then the front of the heart is those last areas. And that is when I think Jennifer is going to have this on the workbook. And my lines are horrible. I apologize. I am really bad at the annotation on this. So that front of the heart, and I told you that camera right there in the front of the heart, when you look at those little precordials, I'm literally looking at the front of the heart, the anterior and the septal wall. And that septal wall is so important. You're going to see that in V1 and 2, and your anterior wall, V3 and V4. All of that is your anterior septal wall. And that last little bit is down there at the bottom of the heart. That left lower lateral wall is V5 and V6. That's that lower wall. And there's a couple different oh, I missed the coronary artery, Jen. I'm sorry. On the front of the heart, you're looking at that LAD. So the LAD is perfusing that front of the heart. Okay, is that what you wanted, Jen?
It was better than I could have ever imagined.
Oh, you know I love my pictures.
As usual. Yeah, I hope. Did you guys really appreciate that? Because doesn't that really help you visualize? I'm telling you, Michelle just has a gift. So as Michelle told you guys, this is the lateral. These are the anterior. And these are the inferior. We're going to go over this more in our breakout session, but remembering that these are lateral, anterior, and inferior. Okay, so Michelle, thank you so much. You're such a amazing coach. Amazing. Okay, now that we talked about the parts of the heart, the other thing I want to talk to you guys about is what step of T-wave step. I think that was step 9. Okay, so T-wave rules. Let's put you guys to the test and see if you have any T-waves that you don't like. So let's practice that. What do you guys think about these? Any of these T-waves? Do any of them seem to be breaking the rules? Any T-waves? And so remember, the rules are all the T-waves should be upright except for AVR and V1. So yeah, V5 for sure, Heidi. Absolutely. It is inverted. So is V6. So is V3. So is AVF, right? And Noelle pointed out that AVR and V1 are positive. That's also wrong, right? They shouldn't be. And Bria said lead too. That's also wrong, right? That shouldn't be. So all these T waves are wrong, 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 right? They should be upright. In fact, almost all of them are behaving badly, except for AVL and V2. They're upright. So this is an example of like a lot of T wave problems, but just knowing the directionality of them is helpful. When you have T waves that look like this, we worry about things like ischemia. Okay. So good job, you guys, on picking those up and spotting those. You picked up all of them. Strong work. So there they are, just pointed out for you guys. Now, I want to talk about this too, real quick. There's a couple things going on in the CKG, but looking at it, do you see any problem with V5 and V4? Now knowing the rules that we've set forth, is there anything wrong with V4 and V5? Because we know V4 and V5 should be upright. So if they're not, and they're inverted, they're not following the rules. So again, why does this matter? Because this actually, or inverted T's, Noel, yes, inverted T's, they mean big bad wolf things like ischemia, okay? There's also another big bad wolf finding on here in lead 3 and AVF. Can anybody spot it? We talked about it on night 1. We talked about it on night 1, and it's there like if it was a snake, it would bite us. It's there, and I'll tell you, the machine is telling you to look in the inferior leads. So Michelle just talked about the fact that these are the inferior leads, if you remember, 2, 3, and F. Do you guys see a problem? Do you guys spot the enemy? Does anybody see? Okay, yeah. So Muna says she thinks she sees a right bundle, and but looking in 3 and F. So technically bundle, yes. Andrea, yes. There are Q waves. There are negative deflections, and they are present in 3 and AVF. But what is the criteria? Do you guys remember? We did this on homework page 1. We said a Q wave is bad. A Q wave is bad if it's at least what % of the R wave? Oh, look at you guys. You guys remember. Okay, so would you agree that this is pathologic? Would you guys agree this is pathologic? These ones? They're pretty big, right? So they're big. Yep, we all agree. Okay, good. There's actually a lot of other things on the CKG, but I don't want to overwhelm us tonight, obviously. But just a side note, I do want to tell you one thing. Have you guys ever seen the machine say T wave abnormality? Have you guys ever seen that? Put a thumbs up or put a yes in the chat if you've seen that before. This is really, really, really important. Okay. So what do you, yeah, a lot, Kara says. Okay, so Kara, this is a very, very serious thing if it says that. There's actually 5 things that if the machine says this, that we need to worry about, okay? And lots of different presentations. The problem is we're not taught these things. And some of them, if we just wait to refer to cardiology, they could die while they're waiting. So if you asked me, Jen, literally, if you could take me as a provider, right? If Jen, if you could take me, Muna, or me, Noel, right? What would, if you had me for 10 minutes, what would you spend that time? If that's all you had with me, what would you spend it on? It would be this. The reason why is because there's so many dangerous things. On this EKG is actually one of those dangerous things. This patient had a severe LAD occlusion, and there was clues, but all the machine said was T-wave abnormality. So there really, really, really is a lot of little big bad wolf things that can live in here, and we're not being taught them. But we are teaching you, we are showing you again, more examples of the inverted symmetric T waves, okay? These also are really bad. So you wouldn't miss this. You would see this. You would be like, yes, this is really bad, right? But what do you do with this? This means they could have ischemia, obviously. So this would not be somebody I would, if I was in primary, I wouldn't wait for cardiology to see them, right? I would get them in quicker. I would get them in probably to the emergency room because T-wave inversions like this are not something to mess around with. So there's a lot of little things like this, right? That we shouldn't wait for cardiology. We shouldn't wait for referral, right? There's a lot of gray area things that we should, this is one of them. Okay, there's actually a lot of them, but this is definitely one of them. Okay, so again, that's knowing the T-wave direction is really, really critical and showing you that the inverted symmetrics are there. Now, this is a little lesson on the importance of getting a clean tracing, okay? This was, I'll tell you the story behind this while you look at it. And remember, this is an EKG of somebody who had a QT of 713. 713 is pretty long. Remember, 460 and up is too long. This patient actually did not have a prolonged QT. Does anybody know what happened? Does anybody know why the machine thought that this was a prolonged QT? Does anybody have any thoughts on that? Any thoughts? This is a hard one. So actually the machine was
replacement, like
well,
where they placed them.
Actually, that didn't cause it the issue, although that can cause a lot of other issues. It was the fact that, yes, Erica, that there's artifact. Okay, do you guys see the artifact? The artifact was faking the machine out. And so it thought one of these spikes was actually the T-wave, when you can see here that there's clearly a T-wave and it's not too far away from its own dad. So we repeated this and the QT was actually 444, normal. So just know that all the things we taught you tonight about, getting a good, clean tracing are important for more than one reason. And this is one of them. We don't want to fake out the machine. Okay. And this is, I think, our last EKG before we go into breakouts, I believe, before we go into breakouts. This EKG, I want to tell you, I want to put you in a scenario. Okay. Because I love putting you guys in scenarios. And you don't have to say anything. You don't have to come off camera. You don't have to say anything. You don't have to come off chat. But even if you don't, just think about this for a second. Here you are, wherever you work, and this EKG is handed to you. It says acute STEMI. A lot of us would want to call our collaborating doc if we have one. If you're solo NP, you don't, right? Or if you're a paramedic, you want to call the hospital. But let's just say there's nobody around. It's just you. It's just you. Would you call this a STEMI? Now, this is a little bit more advanced, right? But I'm throwing you in the deep end a second just to bring you back to the basics, I promise. So remember we talked about STEMI? And I think we talked about it night one a little bit, where we said, hey, for STEMI, we need to have ST elevation. Well, would you guys agree we have ST elevation here? Yeah, right? Yeah, I see people shaking their head. Totally ST elevation. There's no arguing that. Yeah, everybody says yes. Okay. So the question then becomes, in order to have STEMI, the rule is we have to have 2 up, but we have to have 2 down. So someone put that in the chat for me. 2 up, 2 down.
2 up,
and someone
2 down, and 2 consecutive leads.
Yes, in 2 contiguous is, and they are consecutive, but contiguous is the name. And so does this have, thank you, Julia, for putting that in the chat. Does this meet criteria? What do you guys think? This one, does anybody, so let me just stop you for a second. Let's just say we call this a STEMI. We have to call the ambulance, code 3. We have to call the ER. How many of you like calling the ER to tell them you're coming? No, nobody likes that phone call. Okay. And this is how they're going to answer the phone. Why do I know this? Because I'm one answering the phone sometimes. Yep. And I'm saying yep because I've got, all these patients that are like really sick. And then you're going to add to my patient load potentially. And I have to decide if I'm going to take my really sick belly pain or my coding person out of a room for your person. So if you're telling me to STEMI, I got to make a room for you. I also have to call the cardiologist. So Lisa says no. I have to call the cardiologist and I have to tell them to come in. That's not a fun phone call sometimes, right? So how confident do we feel that this is actually a STEMI? Is the machine right? Is it a STEMI? I mean, we have ST elevation. So I see you guys kind of like pedaling back on this one, and I don't blame you. This one's a hard one. So the answer is that it is actually, like Lisa said, not a STEMI. This is not a STEMI. The machine is wrong. This is actually somebody with pericarditis, okay? And pericarditis causes widespread ST elevation with no reciprocal changes. So knowing that 2 and 2 thing is so critical, and practicing this is so critical. And Julia, you actually in Zoom, Julia called it right. It's pericarditis, okay? So as you can see, there's no ST depression anywhere, so this can't be a STEMI. This is why we teach you not to trust the machine software. Okay, so it's not a STEMI, false, okay? So there's a lot of things, right, that can be wrong on the EKG, as we've shown you, a lot of things. This is not even half of the things, but I threw this in because this is a funny picture we can practice on really quick. This is a really big EKG. I don't know, Michelle, if you remember this EKG. I blew it up and brought it with me to San Antonio when I saw you.
Yes, we stood beside it and got pictures and pointed to all of the stars in the PR interval. Yes.
Yeah, it was fun. So you can see what, even though we're not showing you this as a demonstration, but you can see that this is a T wave that's inverted, right? This is biphasic. These T waves are inverted. So is this one. This, and what do you guys think of this rhythm? What would you guys think of this rhythm? This is kind of a hard one, but this was a really cool patient. This patient went straight to the cath lab, but had clean coronary arteries. So cool. So this is actually an irregular rhythm. And this was somebody going in and out of flutter and fib, in and out of atrial flutter and fib. So this was a really, really cool chance to check out a neat EKG. So let me get out of this. Yeah, so fun. And clean coronary arteries, we went to the cath lab. So can you guys see the power? So type in the chat, yes, if you can see the power in using a system, if you can see the power in knowing the nitty-gritty details, if you can see the power in practicing this so that it stays fresh in your mind, right? That's really the key thing, is keeping it top of mind, because we don't always know, we don't always keep it here. So that's why we recommend that you use the 10-step system every time so that it keeps you on task. We recommend that you try to teach this to other people too, because when you try to teach your friends, they learn from you, but you actually have to master it, which helps you too. And who wins at the end of the day? All of our patients, which is why we got into this in the first place. So now we're gonna get ready to go into our breakouts. We have 3 sheets for tonight. You already did one of them. Yes, Michelle, I think that's probably perfect. Okay, so that's one of them. We did this one already together in the main group. We're going to do this one, and we're going to go over the conduction together and the contiguous leads. We'll label them real quick. We'll spend about 10 minutes doing that. But we're also going to, when we come back out of our breakouts, we're going to talk about this lady, an actual case, not a real patient's face, a real case. And we're going to go over everything from start to finish with her real quick, so you guys can see a real case in action, because not just talking about it, but actually showing you. And then we're going to really quickly kind of wrap up what we learned and all that good stuff. So I'm going to stop the share. And what I'm going to do is we're going to, as you guys know, we're going to actually stop the streaming from Facebook. So I'm going to stop.
Oh, there's Jennifer. She's back.
We are actually, I think, streaming live. So how did it go in your group? Michelle, how did it go for your group?
I thought they did really well. We got all the answers done pretty quickly, and we went over contiguous leads. We went over the arteries, and what else? And we labeled the coronaries, and we labeled the EKG, the electrical system. So we got everything done.
Awesome. Okay. So actually, a couple people asked me in the breakout, how can we keep learning with you guys? How can we keep going? And what are you guys giving away in this scholarship? I want to learn more about that. So first of all, I just want to say you guys did great in the breakouts. I mean, this is the first time we've done this. And do you want us to keep doing it like this? Tell us yes or no. If you want us to keep going like this. Yeah. Okay. So in our next time that we teach, which starts next week in our the class that we're going to do called the EKG Launchpad, So the 2 scholarship winners, and then of course, if you don't win the scholarship, one of the students said, who will be invited to the class? You're all invited, right? Now this is obviously geared towards more basic learners. We normally don't do something this basic, but we're gonna start with week 1, doing basic arrhythmias and EKG terminology. Week 2, we're gonna do basic EKG foundations. So expanding on and practicing what we just learned, but going way, way, way deeper into it. And then tons of practice in week 3, and then a ton of cases to practice our skills in week 4, where we kind of pull it all together. So how this looks on a calendar is we try to keep things during the week.
4 p.m.
So actually 4 p.m. that's actually wrong for the 5th. That's going to be 5.
Good.
So for the purposes of the this one, we just changed it to only 5:30. So it'll be Mondays and Wednesdays. So the first Monday is going to be 5:30. The first Wednesday is going to be 5:30. And then on the weekend, we have some workshops just this one weekend. And then we have all the rest of the sessions on Mondays and Wednesdays. Okay. And we wrap it up on the last day with our wonderful, wonderful David, who you haven't met yet, who will do a study hall where he'll basically answer any of your questions. So yes, Kara, you are already in the launch pad. We're going to celebrate you. And these times are all Pacific Standard. Yes, they're down here, Pacific Standard. Okay, so like, for example, 5:30 is 8:30 Eastern time. So we have tons and tons of basic hands-on practice for you guys to kind of solidify what you've learned. So we are going to be actually giving some bonuses away as well. So for the first 5 people who sign up tonight, okay, and these are going to go quickly, guaranteed. We're going to give you guys an extra practice workbook with a bunch of arrhythmias in it. That's going to come with a badge. So if you didn't win one and you wanted one, it comes with a badge and it has video answers with it. So the first 5 people that actually join us will get this $40 workbook as a bonus. So that's pretty awesome. We also are going to be throwing in for you, should you join, a badge. I think we showed you the badge earlier. So everybody who joins is going to get a badge. Everybody who joins is going to get an MI window. Now, I didn't show you this yet. This is a tool that was created by a nurse practitioner that you lay over the EKG, and it color codes the leads for you, the contiguous leads. That's a $20 value. They don't even make these anymore. So we're going to be giving everybody one of those. And we're also going to give everybody an EKG kit, which comes with a workbook, crayons. It also comes with a bigger tool of the RCAT window. It's bigger for your pocket. And then of course the crayons and the painting and all the goodies, all the cheat sheets in here. So these are all going to be loaded up, the MI window, the badge will go in there. So you'll have all the goodies and you're going to get access to all of the classes that we do live, plus all of the ones in the vault. For the past 2 years, any class that you want is probably in the vault. And you'll get access to all that with us for 6 months, actually. So you'll get to come with that schedule we showed you, right, in September for anything live. It'll all be recorded. And then if you want to go back later, like let's say you're later in your month 3, and you're like, I really want to go back and watch something on the waves. We've already got that recorded for you. You're like, I want to study the coronary anatomy more. We've already got a class on that for you. So you can kind of pick and choose. So if you miss a class, it's recorded. If you want to rewatch the classes we do, they're all stored in the guides, just like we do here. You can get 12 hours of category 1 CE, and we mail out the kit 2-day mail. So people who won the kit yesterday, we already sent it out. It's exactly kind of designed the way we do this. So you join and interact in Zoom, just like we're doing now. You have access to your class portal. So you're going to have a portal where everything is stored as well. And you'll have access to that for life. So the 12 hours of CE classes, you're going to have those for life. But you'll have access to our group and all of our live stuff for 6 months. Okay. And then there's more advanced material. Of course, if you want it, we can kind of show you the way on that. But we want to focus on the basic stuff. So yes, we have something on heart blocks. Yes, we have other coaches, not just me and Michelle. There's other coaches like Coach Sean who does heart blocks. So that's all going to be waiting for you in the launch pad. So what we do is we basically get you signed up. We send you the receipt. We mail out your package. We attend the class, and then your CE is issued. Now, the great thing about this is that your CE is based on the classes that are already recorded in your portal. So like you could literally come to nothing live and still get all your CE. We just do the live stuff as a bonus for you if you want to interact like this. So this is only $199 and it's not going to be this price. In fact, we're not going to do this again. This is the only time we're doing this. So don't hesitate. Linda's actually in our other program, our 30-day EKG challenge. We love having her in that, but this is actually our basic program. So that's why you're getting all these special tools. You're getting lots of access to us like this on Zoom to ask questions. And as you can see, you now know why I love Michelle so much, and you will have lots of access to Michelle as well. So you have a good team waiting for you, a solid team. And I do want to, if it's okay with you guys, I want to do one last case to wrap up, and then I'm going to do the winners. Okay, so go ahead and ask questions right now while I pull up our last case, if you have any questions. And I'm going to show you that 50-year-old female we were talking about, and we'll kind of put this into action. All right, so pray from current slide. Okay, so
how many hours of continued education is it?
It's 12. Oh. Is that Bria?
It is.
Bria, where have you been?
I've been here.
I know, I see you cheering people on. You won a badge tonight.
I did.
I know, I got to get it in the mail for you, girl. All right, so Bria, just so you guys know, is one of the group cheerleaders. She found us recently, and we love her, and that's just how we are in this group. So this is the case, not a real patient's face. So put on your EKG hats for a second. Okay, this is kind of what we do for our cases part, just to give you a flavor at the very end to wrap it up. So this lady, 54, she presented to the primary care office with chest pain for 2 months, and it was chest pain with exertion, walking 2 miles, and 10 minutes into the walk, she felt like she had to push through despite her symptoms. Okay, she had to push through. So she then got referred to cardiology. She had syncope 3 times this month with exertion. That's never good. Okay, and her dyspnea on exertion and her pain was worth the exertion. So exertion, that's a bad thing. Anybody have any thoughts on that? Any thoughts on exertion? Okay, and was given nitro, and it helped. Also a clue. So here's her EKG. This is her real EKG. So let's just see what we think about this. Now, if you guys have been wondering, Jen, why the heck are you harping on this T-wave stuff so much? I don't really understand, Jen. I mean, gosh, I'm still over here at the P and I'm at the QRS, but why do you care about the T so much? Well, I care about the T because it's super, super important. Okay. Thank you, Ruben, for posting the link. So let me show you. Do you guys see anything that worries you with this lady? Anything in her history, in her EKG? I'm just going to color something that I'm seeing that I'm not liking. I'm seeing that. I'm seeing, I think somebody said this last night. I forgot who it was. I think it was Kara. Kara said hockey sticks. Was it Kara? It wasn't you, Kara? Come off mute if you're on.
I had to work last night.
It wasn't you. I thought it was you. Somebody said hockey sticks. So Kara, speaking of, you're already in the launch pad, and I don't think you're in the Facebook groups. And I sent you the email.
I signed it this morning.
Okay, you did. All right, perfect. All right,
Thank
so because you're gonna get access to all the stuff. I'm so excited for you. So Mari says ST depression in B2. Okay, so let's take our pen and let's see if there's ST depression. So that's an easy thing. So we go over here and, oh, yeah, there's a tiny bit. But what's sticking out to me more than that is here. How do we describe this and this? How do we describe these? These T waves are inverted, right? These T waves are inverted and they're symmetric. So yes, Damaris and Carrie, they are inverted. So inverted T waves are never good. So are you guys worried about there being ischemia with her? Are you guys worried? Like on a 1 to 10 scale, 10 being the most worried, what's your 1 to 10 on this lady? How, like 10 being so worried with this EKG?
10.
Okay, me too. No, that's good. So also, did you guys notice the T-wave inversions in 1 and AVL? Those are also not normal. And the voltage in AVF is almost flat. So low voltage is something to worry about. So are inverted T waves. So She's got a history, the triad. She smokes. She's hypertensive, has hyperlipidemia, and her family history is pertinent for mom and brother have pacemaker, and there's lots of hypertension. So she gets a stress test. In stage 2, she develops ST elevation and AVR, and ST depression goes into multiple leads, persisting 23 minutes into recovery. What do you guys think we need to do for her? I know. Let's give her Shantix. Let's give her Shantix. Okay, so Carol, you said calf. Yeah. Do you guys think we should take her to calf, an angiogram? I think we should take her to, okay, good. Yeah, Mari says angio. I agree. Let's take her to calf. So here's what we found. Oh my gosh. Good thing you guys took her to calf. Complex multivessel coronary artery disease. Severe distal and left main. Okay, also the left anterior artery, circumflex. She's got triple artery disease. Her EF is surprisingly preserved. So what do we need to do to her now? I know you guys aren't all cardiology providers, but if she has all 3 arteries blocked, what does she need? Yeah, CT surgery consult, cabbage, good, perfect. Good job, you guys. That was awesome. So what did you think about going through a case? Was that kind of fun? Because you guys did great. You guys did so great. Okay, so any questions? Otherwise, I'm going to draw the scholarship winners. Any comments or questions, let me know. Otherwise, I'm going to draw the scholarship winners so that you can, if you don't win, you can go grab your spots. Because of course, if you're one of the first 5, you also get that workbook, which you don't want to miss out on. There's only 5 of these. So, all right, scholarship winners, good luck. All right, let's see who's going to win our scholarship. Now, remember, we have 2 people who are going to win scholarship. These were both given to us by Carl Barker. Love him. So our first scholarship winner is Noelle. Noelle, you won the first Carl Barker EMS scholarship. So congratulations, Noelle. I have to put your name over here. And then the next Carl Baker scholarship winner, I know Muna's like, fingers crossed. Muna's like, fingers crossed. The second scholarship winner is Patrick. I don't know Patrick's last name. So if you're not here, Patrick, you may not know you won. But Patrick and Noelle are our 2 scholarship winners. Yay, congratulations to you. We have a male and a female. That's perfect. So you guys are the scholarship winners. So make sure to message me. I'll be getting you your kits mailed out and your access. So that's exciting. But in the meantime, for the rest of you, yeah, congratulations, everybody. For the rest of you, we're going to hopefully see you, because this is our last night together. We're going to hopefully see you in the EKG Launchpad. So again, I think we're putting the link here. Tori, thank you. Again, I just want to say a big thank you to Carl for giving these scholarships, for paving the way for fellow students, and also for Coach Michelle for being amazing. Coach Michelle, do you have any final thoughts for these wonderful people that you've been able to coach tonight?
I had so much fun. Y'all were just amazing, very interactive. It was a lot of fun. And I just hope somebody joins in with us because we have more stuff to learn. And I love the basics. And y'all haven't even met Skelly yet.
Tell them about Skelly. Tell them about Skelly.
Skelly was my neighbor's and I stole him from her. And so he comes in and he has EKG leads on him, and then I put his little heart in here so y'all can see how these little EKGs work.
You're not a visual instructor or anything, are you?
No, not at all. Not at all.
No, not at all. Cool. All right, you guys. Well, thanks for being here. Evelyn, I think you're already in our 30-day. Your name looks familiar. Damaris, I think you're in our 30 days. So and Linda, you're also in. Oh,
Jennifer. Oh.
Yeah.
This is Valeria. So
Valeria,
I
hi.
previously signed up for the 30-day a few years ago, but when I just tried to sign up for this class, I had to use a different email because it wouldn't accept my password. So
okay. Yeah, so that's fine. You can do it that way. That's probably easiest. But are you still able to access your old 30-day portal? Because if you're not, I can send you a password reset link and it'll get you in.
The password wasn't working, so I just used a different
so you'll probably have 2 logins, but just message me on Facebook and I'll send you your password reset for your old 30-day because you have lifetime access to that.
Okay,
girly. Also nice to have you on. It was so nice seeing you guys' faces. I can't even tell you. I'm so, oh, yes. Hi, Heidi. Do you want to say something? No?
Jennifer, Kara asked the difference between the 30-day and the launch pad.
Oh, yeah. Good question. So, Kara, I think you've signed up for.
I'm in the launch pad.
I think, yeah, you're already in the launch pad. So basically we do the 30-day. It's a little more, we're going to be offering that again in October, but that's basically more than EKGs. It's stress testing. It's how to read Holters, how to read echoes, reports, how to work up a chest pain, how to work up an AFib patient. What about the anticoagulants? How do you write a soap note? Kind of like, it's a lot of stuff. Muna,
Yes,
thank you.
I would like to join the 30 days.
You want to join the 30?
Yeah.
Okay, well, we can get you in now. I can just message me. I'll get you the link. We can get you in now. You can have access to all of it. But it's a different price than the launch pad. So I'll message you the details. And we won't be doing much live in that until October. We're doing most of our stuff in the launch pad because we're just going basic EKG. But Muna, are you cardiology, primary, urgent?
I'm an EKG technician.
Oh, then you would really like. Oh, I see why you would like all that bonus stuff, huh? You would like.
So I'll message you later. You know.
Well, yeah, message me because you actually would get
Yeah.
the student rate, which would be super inexpensive, even less than the launch pad. So message me. I'll get you that link. We'll get you in.
And
Sure.
Jennifer, Erica also wants the details.
Oh, what do you want the details on, Erica?
On the joining or
The 30-day.
Okay. Yeah, no problem, Erica. Basically, the 30-day is a program that we usually do once a month. We've transitioned this time into the launch pad. So when you join the 30-day, you actually get access to both groups. But the launch pad is just specifically basic EKG stuff, just EKG, just the basics. In the 30-day, you get access to 2 years of study halls, 2 years of, gosh, what else have we done? Heart murmurs, we've done heart failure, we've done, gosh, so many things, palpitations, workups, all the things. So I'll message you the details, but Erica, you have to tell me, are you going to want to do CE or not CE? Because not CE is I think it's $127. So it's a really good rate. And you
Not
still get
CE.
your- okay, then it sounds like Muna and Erica, just message me. I'll get you the link and you'll still get the EKG kit and everything. So that'll be awesome. So message me and
you.
I'll get you the link. Yeah, it'll be super exciting. And we'd love to have you and Muna in the group.
Miss Jennifer.
Miss Bria.
I have a question. I think I saw where Marie had asked a question in regards to can low voltage also be caused due to lead placement? So I had a question similar to that to see what's common causes of low voltage. I know we did pleural effusion as one, correct?
Yeah, so actually Valeria asked a question too. I'll get back to that. But yeah, voltage, basically for low, a lot of the times it'll be obesity. That's the most common, or COPD. And also a lot of times you'll have like a pericardial effusion that could cause low voltage. But you know, honestly, we also have to worry, like you saw in that last EKG, we have to worry about ischemia. Ischemia can cause low voltage. So there's many different causes. And it honestly just, you always worry about the worst first, if that makes sense. So make sure it's not an effusion and then you can blame it on something else.
Okay.
Yeah, good question, Bria. You're still in school, right?
No, ma'am. I finished up last August.
Oh,
So
that's
it's been a
right.
year.
You're in internal medicine, right?
Yes,
Internal-
ma'am.
That's right. Okay. Try keeping 15,000 people straight.
No, I understand.
I know, it's crazy. Okay, so Valeria, so I have to check to see in the purchases if you are one of the five, the top five. I'm sure you are. So I'll let you know. Just put me a little message in Facebook Messenger. That's the way I keep track of everything. And I see that I don't think we have any more questions, right? Looks like, yeah.
I didn't see anything else.
Okay.
Kara just says you're going to start another 30-day in October. That's correct.
Yep, we are. So yeah, what's going to happen is that's kind of the same, usually the same times. People, we voted in that group, people said they like classes on Wednesdays for some reason. Wednesdays are good in the evenings. We're trying to keep things out of the weekend, but sometimes we have to go into the weekend to get all the stuff in, but we record it. So if you're busy, it's okay. But we're going to have basically guest lecturers come in. We have lots of guests, actually. We've had pacemaker classes. We've had, you name it. Carrie, what is it again that are you cardiology?
I'm a PA in cardiology.
Oh yeah. So you need the 30-day. We should talk offline. Yeah, you need that for sure. So we'll talk more about that. And I think that's all the questions. So the links in the chat, hopefully you're one of the first 5, so you can get the workbook. The MI window, somebody asked me about that, I think, and I didn't answer that yet. So the MI window, that is something that if you didn't want to purchase the Launchpad and you just wanted that, these are $20. You can message me and I can get you one. They don't make them anymore. It was made by a nurse practitioner who was a cardiology NP. She was brilliant, but she's retired. So I have some of the last ones of hers. So you can message me and I can get those to you. So anyway, it was so fun hanging out with you guys. Such a pleasure. Luna, you've been here every night. And honestly, just seeing your faces. Bria, I thank you for cheering people on. Karen, it was great to see your face a lot too. Anybody who came off camera, it was super fun. Oh, Patrick's on. I see your name, Patrick. You're on Zoom with us. So Patrick, did you hear that you won one of the scholarships? Hopefully, Patrick. So anyway, reach out to me in Messenger. I'm going to go get all your questions answered and have a great evening. It was so much fun. I'll see you guys later, hopefully in the EKG Launchpad. All right. Bye, guys.
Thank you so much. Thank you.